SVG Tire Sales and Services. Performance and reliability proven when the rubber meets the road.
That's the sound of your animals. Strong, healthy, and delivering yields you love. That didn't just happen. It began with you feeding them only the best. East Caribbean Feeds. Rest assured, we only produce your feeds with premium ingredients. No hormones, no animal byproducts. Just everything your animal needs from maximum nutrition. Because your animals deserve only the best. East Caribbean Feeds from Maximum Nutrition.
ECGC has slashed feed prices by 8 to 10%. Check your local supplier for more details. ECGC, providers of feed for maximum nutrition.
WEFM, the new fresh sound.
WhatsApp us or call us at 457-9997. Activated Mornings on WEFM 99.9 is on now.
The time here on SVG, it is 8:15, and as mentioned earlier, we will now be conducting a discussion. Let's use the word discussion, all right, with Dr. Tami Williams on prostate cancer, causes, risk factors, and prevention, all right? So all the men gather around and all the women gather around the men, all right, so that we can have this discussion. So good morning to you, Dr. Williams.
Hi, good morning. How is everybody doing today?
We're fine. And joining us as well is Nicole Joseph Chin from, she's in Trinidad, but she's there with us. All right. So good morning as well.
How are you doing, Nicole?
She's Erin.
Okay.
Yeah, muted and Nicole.
I am well. How are you, Doc? It's good to see you back. Welcome back.
Thank you. I'm back again. They brought me back.
Yeah, because these are important.
Dianna and Roleza.
These are important. These are important topics. So, yeah. All right. So over to you.
All right, over to me. So, before I start, I think Rajiv is missing, though. What do you think?
Rajiv Foy.
I am not against it.
Let him sit right next to you.
Off topic, but I notice is a lot of females these days, right? I just want to encourage our young males, right? To how to put this? But y'all understand where I'm coming from.
No, we want to.
I'm not bashing the females. I'm in support of females. Right?
In terms of what, though?
No, because it's
announcers, you mean?
Yeah, announcers.
Oh, okay.
Right. Roleza, Dianna, Nicole, you get the pattern.
Yeah. Okay.
So that's why I joked about Rajiv being present. Yes.
Okay.
And then also the topic of prostate cancer. Right? Not bashing our females, of course not.
Okay.
So let's start off. Anybody know anything about prostate cancer? You know, I would come with it. Yeah, of course.
I knew it. Well, it's a cancer of the prostate which affects males. You know, females do not have that prostrate gland, as far as I know. It's in the males, in the back. Shall I say the rectal area? That's the correct word. Is that?
Some are behind there, some are up there.
To be more specific, it's below the bladder.
Okay.
Right? And the rectal region is behind.
All right. So in that area there, in that region across.
But I'm proud of you.
I get a sticker. Yes. And the rest I'm going to leave up to Roleza and Nicole.
All right. So in terms of the cancer part of it, I think it's the condition that affects men mostly, like how cervical affects most of us as women. And I also know that it is the exam itself is one men do not like to do, right? Which is why for many of them, it goes undiagnosed for so long. So, yeah.
That is correct. That's an important point, Roleza.
Yeah. All right.
Especially our macho men.
Well,
But
maybe I could.
health, I'm encouraging men to put that aside if it's warranted, right? There are other tests that you can do, not just that alone, if for their comfort.
Right. I think student number 3 is going to give the answer now.
Well, I was actually going to say exactly that. That not only is the digital rectal examination one of the only examinations, there are new technologies, there are many tests, and more importantly, early detection can save many lives. And Dr. Tami, I just want to say this to you, right? My
Yes,
father was actually diagnosed with prostate cancer over 15 years ago. He's now deceased. But I remember his urologist saying something very important. Thank you. His urologist, whom I have a very good rapport with, said, James, prostate cancer is not going to kill you. And that's because he was diagnosed early, he did his screening, he had his remedial testing and everything, and then he had surgery. And you know what my father died of? A massive heart attack 8 years after being diagnosed and treated and in full recovery. I'm saying this to say to men, you will not die if detection happens early enough. And as Dr. Lila said, it wouldn't be the source of your death. So this is just to encourage.
Okay.
All valid points. I appreciate, and I'm going to touch on a bit of each of the things that you guys you mentioned.
Okay, so just to note, listeners, what we would do is that we'd allow Dr. Williams to give her presentation first, or to give us the information, and then we'd open the lines for calls, all right? Because I see that persons are calling already. So let's just allow her to do the presentation, and then we'd open the phone lines, okay?
Okay, so I would start off with a little background on prostate, right, as usual. So the prostate is an important male reproductive gland, right, and it's situated below the bladder, and it has numerous roles. So the most important, I would say, is the production of fluids that would help to nourish and protect the sperm, right? It also it contracts to help ejaculate that magical fluid, ladies, right?
And men too.
Yes, everybody knows what I'm talking about. And also it produces something called PSA, prostate-specific antigen. The PSA would help to it will help the mobility of the sperm to move better, and it also prevents urine from coming at the same time as the ejaculate, which is the right. So it's you could say a walnut size gland, and what is important with prostate cancer in specific is that it is gradual, right? It takes time to develop. It's one of the most insidious cancers out of all of them, right? So it actually has a very favorable prognosis, and as Nicole said, a lot of the times persons actually would die from other issues like comorbid issues, heart attack. Well, in that case, it would have been from the surgery, a complication after, rather than the actual prostate cancer itself, right? So yeah, that was a good bit so far, right? So let's delve into the how it works basically. So the PSA, person's probably wondering, how does a PSA have elevated? I'm sure you all heard of that. Elevated PSA is connected with prostate cancer. But do we know the link or the reason behind that? So PSA, for those who are not familiar, that's another test apart from the famous test Roleza mentioned, which is called a DRE, digital rectal exam. So the PSA, what happens, and I focus in terms of the cause for this because I find it's very important for persons to know why they're doing particular tests, right? And it's very important in prostate cancer. So what really happens is a protein, is an enzyme. Enzyme is a protein. And prostate cancer damages prostate cells, right? We know about cells, right? So when the cells are damaged, it's specific to the prostate, it's PSA. So it leaks out of the cell basically, and then it goes into the bloodstream. And then that's how we detect it, right? So let's move on to risk factors. What is the most important risk factor that you guys think may be associated? Anybody, if you know. If not, moving on smoothly, it's fine. Perfect. Wow. I'm so proud.
And hereditary?
A plus.
Nicole, your turn.
You said hereditary. Mm-hmm. Let me hear, Nicole.
What else was said? Was age said?
Yeah.
Mm-hmm.
Oh, okay. So age, hereditary, and of course, lack of self-care. Just
but
awareness.
That's the most
care.
important.
Mm-hmm.
And so, what you said, Nicole, lack of
caring and checking.
Okay.
Yeah, because if you're aware and you're checking, then you'd be less. The detection will happen over a sooner period of time.
Understood.
You're asking about cause?
Well, risk factors. I understand.
Because not cause but risk.
I agree. I mean, it's not the typical textbook one, but I agree. Tami, agree. Right. So, Dianna, you're actually, both of you guys are correct, but the most important one is age, right? So typically greater than 50 years. Family history is also important. And obviously with persons with family history, you will screen them earlier than the typical population. Race also. So
it's Black
African American race. Certain genes will put you at risk for it, and also what you eat, right? So a lot of saturated foods, all the oily foods that we like to eat, the junk, the fried chicken and what's not. Well done meats, red meats on a whole, and calcium, too much calcium, right? So moving on swiftly. Epidemiology, we call it. So just you could say stats, right? So I'll just talk briefly, very, very briefly. So the incidence, it is, remember last week I mentioned incidence, the amount of new cases of a particular disease, prostate cancer this time. So it is the second highest after skin cancer for the incidence. And let's touch on mortality.
Is that a Caribbean-based stat or is that international?
That's international. That's US-based.
Okay.
Right? I'll try next time. You see, sometimes what happens, if research is not done, it's a work in progress for us as Caribbean persons in terms of the database.
Or even locally?
Yes, right. That's what I was getting at.
Okay.
So I would try to get stats local and regional stats.
Okay.
Right. So in terms of the mortality, is the second leading cause after lung cancer for males in specific. Right, the males. Symptoms. Anybody know anything at all? When we talk about the pee, anything?
I was going to say probably pain when you're urinating.
I think blood in the urine as well. That's one, right? Erectile
plus.
Nicole, all right, you give the next one.
Erectile dysfunction,
right.
Perfect.
Discomfort in the region. Sometimes there might be regional discomfort.
Yes.
Okay.
Right. And just to touch on the discomfort, right? It is possible with prostate cancer, but it's especially more common in prostatitis, which is like a inflammation. It could be an infection of the prostate, right? You tend to more have pain, especially when you're doing the DRE, the rectal exam, as opposed to the cancer. You'll tend to not really have much pain when you do that exam. Right. And then when you do that exam, the physician may feel may find lumps or like one, because it have different, it's divided into different portions, right? So one side might be bigger than the other side, right? Call it asymmetry. So those sort of stuff would more indicate that is a prostate cancer. And there's something also common too called BPH. I don't know if you all have put up on it in any reading or hearing anything.
I think so.
Benign prostatic hypertrophy.
Oh, no, not that at all.
We could just stick with the BPH, right? So it's a very, very common differential for, when I say differential, I mean alternate diagnosis, another cause of what you think the patient's symptoms are, disease-wise, right? And that one is benign, so it's not malignant. So it could present with the same symptoms as
all right.
prostate.
So what I would suggest, break that down for persons who may not understand. All right. So what's benign and malignant?
Right. So benign means that it is not cancerous, right? And malignant means that it is cancerous, right? So we're on the same page?
All of us.
Right. So the symptoms for both the BPH and the prostate can be similar because it's BPH is like an enlargement of the prostate, and prostate cancer is an enlargement of the prostate too, because the cells any cancers is a result of replication of cells, right? So it's a growth of whatever tissue. So that's why they would present with similar symptoms, right? So let's continue. Before I continue, Nicole mentioned a very valid point in terms of early detection. That's very important. And I also want to emphasize the point that, I mean, it's very cliche. I think I heard y'all talk about it sometime on the radio too, but prevention is better than cure, right? So prevention is even better, right, than even the early detection. So in terms of the symptoms, as most cancers, a lot of it tend to be asymptomatic. Most of the times when it's diagnosed, is more from like a screening test, just an incidental. You go doctor, you do a PSA, and then you find it's high. But it's most of the time at that point, it's not big enough to cause symptoms, because the symptoms it causes is mainly because of the size, right? So in terms of the urine now, you could have like a weak flow, blood in the urine, like you would have mentioned, pain in the urine, urgency, we call it. So you just have a sudden urge just to go to the bathroom.
Would they have trouble urinating as well? Would that be a problem? Like if you're standing there, you want to pee, but
yes,
you
call that urinary hesitancy. So it's like you're trying to pee and the pee just not coming, right? Then you have frequent urination as well. And some persons may say they feel like they can't control the bladder, right? The urine is they just sit down, the urine come out, right? Sometimes also persons may feel like they're not completely emptying, like they would pee, but they just feel like they still have, and all those are symptoms of the tumor compressing and the tube that the urine flows through, right? You could also have bowel dysfunction and signs of metastasis. When I say metastasis, I mean spread to whether local areas or distal areas in the body. So in terms of the metastasis, symptoms, you might have bone pain if it spread to the bone, or swelling, especially common in the legs. And this is a sign that it has infiltrated the lymph nodes, right? Some persons may complain of weakness, and at that point, if they do complain of weakness and with a diagnosis of prostate cancer, that's a poor prognosis, right? That means that it's spread to the spine, right? So it's more, we call it palliative treatment at that point, just based on your symptoms you manage. Also back pain you may have, and generally, I don't think I touched on this. Maybe I did last week, but you call it constitutional symptoms. So it doesn't have to be specifically related to cancer. it could be something else. Maybe you have some sort of stressor in life, and you'll understand what I mean. And because one of the symptom of constitutional symptom is loss of appetite, right? So you understand when I say the stress related aspect of it. Weight loss, especially if it's not intentional. You see, so there are different causes. Somebody might lose 30 pounds, you jump and, general population, okay, well, what she have? Either HIV or cancer,
Lord, yes.
right? But if they're gymming for, 5 days in the week, 2 hours, is expected, right? So everything you have to take into context. So in terms of the diagnosis, now how we doing at the time? Not too bad. Well, this time I know for sure I have time.
Yeah, you're okay. Maybe like in another 5 minutes or so, we would ask for the lines to be open.
Okay,
right?
no
But
problem.
We're going.
Feel free to cut me off at any point.
No, I want for you to give the full thing in case persons have multiple questions, just in case.
Okay,
Right.
Right. So the diagnosis, I would have touched on the PSA. But you also have to bear in mind there are a lot of things that could affect the PSA. So, for example, trauma to the prostate, infection.
How could there be trauma to the prostate? Very curious. Okay. Oh, all right. Let my mind go there. Okay, so my mind went there. Those of you, let your minds go there. And
I think you went too deep.
All right. Okay. Go ahead.
I mean, it could be an accident, right? It could be a punch injury, from fights. When I say accident, I meant motor vehicle accident.
Okay.
Right? That's sort of trauma, right, Roleza?
That's one of them.
That's
okay.
All right. Okay, I agree. So, also doing a DRE before, right, is important for persons to know this. Especially physicians, doing a DRE before can cause an elevated PSA. So preferably when we are doing the PSA, we would avoid doing DREs, right? During that time. Could be done at a different time. Normally, I know it as if the value is less than 4, right? It's important to note the units generally because somebody might say, Roleza, my value is less than 4, right? But for what, right? But I don't have to get into the specifics, but it's just for the public to know. Take note of the values of whatever lab tests you would have gotten because it makes a big difference, right? So, yeah, like I was saying, typically it should not be greater than 4, but there was a study that stated that 15% of prostate cancers actually would be less than 4 in terms of the value, and they have prostate cancer, right? So because of that, they shy away from the 4, and we are now tending towards 2.5, right? So if less than 2.5, for sure, more than likely it is not prostate cancer. Right? So the PSA is very important to monitor for recurrence of the cancer as well. And the gold standard is what? For most things, most cancers, I should say.
Can't answer this question.
The gold standard once you know that you've
to confirm, I should say. Well, the definitive, so the confirmatory test to say for sure this person. If you do it and it's positive,
a biopsy.
Yes, right. Because the thing with the PSA, it could be high, but it could be high in other things too, right? So it's not specific for that. So that's why they advise it be done in adjunct with something else like the finger examination, right? So the biopsy, it gives I'm not sure, well, you guys, there's this thing called Gleason score, which is very important to note because based on the Gleason score, that will determine the treatment. So the higher the score, the poorer the prognosis. They will determine the prognosis as well. So the biopsy is not done on everybody. If your life expectancy, we know what that is, right? No? The probability of you surviving is less than 10 years, then it's not indicated. Right? Because remember, the point that I was emphasizing is a very gradual process, right? So more than likely within that time frame, you're not going to die from the prostate cancer.
Okay, so with that, if a man is diagnosed at age 60, then it would not be done. Life expectancy for a man in St. Vincent is what, 65 or 70?
Let's say 65 sound a bit low.
Yep.
I don't want to say the specific statistics. I have to do my proper research on that, but I think it would be a bit higher. I'm wrong, not too higher than that, but
probably
still sound a bit low. Right, you were saying.
Okay, so as of 2023, 71. 71 years for a man. Okay. So if he is, it's confirmed at age 61, what would happen there?
In terms of
treatment, would the biopsy be done? In relation to the point that you were making before, would it be advised? Because you were saying the biopsy wasn't done on everybody, right? It isn't done for everyone, given what life expectancy is. But if the life expectancy for a man in Vinci is, let's say, 71, if he is diagnosed at 61, 62, would it be done? Would it be advised that it's done?
So in terms of the life expectancy, what I meant specific here with the 10 years is that, say, for example, let's say you have some sort of serious ailment, right? So let's say lupus, right? And it's really bad. And then the doctor said, based on your symptoms, what you're having right now, more than likely you're not going to survive beyond another 10 years. Or maybe you have another cancer somewhere else, and then the doctor said, because of the nature of this cancer is so aggressive, you only have 10 years to live. So in terms of that 10-year life expectancy specifically is what I was talking about, rather than a specific age, like say 60 or 50. So in that case, if it's if he's expected to live less than the 10 years, then you don't do biopsy. Okay. But if he's expected to live more than 10 years, so you have like a 15, anything else, right? 15 years survival to live time span, then you can do the biopsy.
Yeah. All right. You want for us to, I know you can continue, but you want for us to open the phone lines now?
If anybody have any questions at this point.
Okay. All right. So the phone lines are now open if you wish to engage with Dr. Williams. The number to call is 457-9997. And I see that there is a message on the WhatsApp, a question.
So somebody wants to know, they're saying that their grandfather and great-grandfather died from prostate cancer, and this person has to do some regular checkups, and they want to know what is the probability of them having it. They say it's not recorded in their father's medical history. So their grandfather died of prostate cancer as well as their great-grandfather, and they want to know what is the probability of them getting it.
Although their father doesn't have it, right?
So providing this is a male, firstly, I would like to say that they should screen from an earlier age. So typically 40, right? Different resources would say 45 to 55, but you screen earlier. And the risk is double. Yeah. If it's especially, they said the father, right?
The father did not. The father apparently didn't have it, but their grandfather and great-grandfather both.
Oh, great. Well, it's a double risk, double to triple in first-degree relatives, right? So I guess we could do the maths in terms of that. If it's a second-degree relative, it could be less than double to triple, but there's still a risk, but especially for first-degree relatives. So if it was like, say, father, right, like the parents, then
higher. Can you describe the different exams, like what exactly is done for the well, you know the different exams,
right?
Yeah.
All right,
so pause with mine. There's a caller.
Hi, go John.
Hi, caller. Morning.
Morning, ladies.
Hi, good morning.
I have a question, and the question is, which you would get a better prognosis from, the PSA or the digital test?
So you get with a better prognosis, do you mean which result will be more accurate?
Which will be more accurate?
Right. So the PSA is actually the recommended screening modality test, right? However, the DRE is an adjunct. So, for example, if the PSA comes back high, you can do the DRE. So, if DRE and PSA are both positive, is a high indication that the person would have prostate cancer. Still, providing that a biopsy is warranted to definitely confirm the diagnosis. But the PSA is the more specific test, and that is the one that we would normally use for screening, although with the screening it's a bit controversial because remember I was explaining with the 15%, right?
The reason I asked that, the reason I asked that because I heard a doctor on a radio station here in Barbados saying that the digital test, you can actually feel the prostate, how flat it is, so that you get a better idea of the size of the prostate.
Right, that is correct.
If you do a PSA.
That is correct in terms of you get a feel of the size, and not just the size, and irregularities, so like nodules, asymmetry, like I mentioned prior. But you would not screen with a DRE alone, right? So you would use not to say that you can't do DREs, right? DREs are important. Is actually part of the follow-up plan for person diagnosed with prostate cancer on a yearly basis for them to do DREs. So it is an important test, but you ask with out of the two, the PSA would be still the better choice.
And the biopsy, I was told that the biopsy is not really recommended unless it is absolutely necessary.
That is correct. Right, that's correct.
Okay, ladies, I will continue to listen to you bright and brilliant ladies.
All right, thanks,
thank you.
Thanks, caller.
You're welcome.
All right. All right, so just remember, the phone lines are open. The number to call to be interactive with us is 457-9997. All right, so Tami, there was a question from Dianna.
To describe the test, how the tests are done.
Right. That was your question, not from
no, mine.
Oh, I thought that was from the
Oh, from a listener?
Yeah.
No, that was Diana's question before we took the call.
Okay. Right. So in terms of the test, the PSA is a blood test, right? Can be done. It's available in our public system. It could be done privately. So then you'll get the value, and like I explained in terms of the values. The DRE, it's basically a doctor inserting preferably one finger, right? One finger.
Let it feel the discomfort we just feel.
One finger. It's supposed to be one finger, right?
All right.
A glove the finger into a person's anus, right? And you would lubricate. So guys, there are things that would make it
easier.
Yes, easier, right? For all the guys out there. So
we have
the lubricant. It makes it easier to perform, and there's a technique too. We don't just
so that's
as Vincent just say jerk with finger up,
right? Okay, Tami, put a pause there. We have a caller. Kojo, morning.
Morning. For someone who took that exam already, I'm not afraid to say it was very embarrassing for me to allow that to happen to me. But
I understand.
Were you
I
concerned?
try to be a male
Were
here.
you concerned about being embarrassed or your health? Which is priority here?
Well, I was concerned about the embarrassment of someone sticking their rectum as the proper word, I should say. I mean, I wanted to say the other word, but because I know what the reason for it was, it was more easy for me to allow it to happen. And I have to tell guys, it's not the person is not the feeling of your butter. Anything is nothing. Because matter of fact, by the time the exam was finished, I didn't realize that the guy was finished.
Okay, that's a good thing.
You know, I mean, I saw the gloves went on, and I didn't look. I did not look back to see what was going on back then. So when he told me he was finished, I'm like, damn, that was quick. But it's very important that you do that kind of exam. I'll be honest with you, because sometimes, as most things in this, because there's very people who have like a family history in terms of medical history, because you know there might be records in the hospital there, but I don't think it's digital where they could just punch in and everything pops up. Like me, since I've been in America, I could go into from the very first day I went to the doctor to the last day I went to the doctor, and everything is there. Right now, I have that on my phone, so in case I get sick instead of this one I'm there, I could go to my app and show them what all tests that I did and whatever I do. So it's important as a man. I am feeling to brothers, because too many brothers are dying from not seriously taking that test as a very important test in your life. It's very important that you do it. Just like a woman have to do mammogram and all them kind of stuff, and we have to do it too. We have weak parts in our body that we need to be sure that it's still strong. And then another part that you were saying about the urine, guys, is not only cancer that cause you to have things, could be diabetic too. So I mean, I know you're talking about cancer, but sometimes the urine thing might tell a man, oh, you probably have prostate cancer. But if you have diabetes and you probably don't know, you'll probably not be going to the bathroom pretty often.
That is very true.
So,
that is very true.
So the frequent urine is not just for cancer only. If you're urinating too often, sometimes you have to either, and not that urinating too often, if you're not drinking water. Let me say, if you're not, because I drink a lot of water, so I urinate a lot. But if you're not drinking a lot of water and you're urinating, that's a problem.
Okay. And let me ask you, at what age did you take your first exam?
I was 50.
Okay.
No, I think I did it at 45.
Okay.
Because I think I have prostate cancers in my family that I know of. So I think I did mine at 45.
Okay, so you did it as a preventative. Okay. All right.
Yeah.
All right.
Well, no, out here because of my medical insurance. My medical insurance is with a hospital. You probably don't know, it's called Kaiser. And they will hang you down. They will call you night and day to come and take your blood test. They'll call you night and day. Right now, I have to go and do another one of those same tests you all talking about. And they don't call me 3 times already, so that means I have to go this week.
That's good. We probably need a healthcare system that runs people down, because All right, Kojo, thanks.
Yeah. All
right.
Thanks for your comments.
And he sends something with a child running bay bottom. All right. I'll tell you something else. Dave, good morning.
Hey, good morning.
Morning.
It seems as though you're all having fun with this thing, but
we're here to support you all.
Question. Hello?
I said we're here to support you all. We're not having fun. Go ahead.
No, I don't make these things a problem for me, I had a test, a PSA test. I can't remember some years ago, and everything went so smoothly. You think about it. Um, the doctor didn't insert any finger in my buttocks, and because I before I did it, I was hearing all this talk about you know, men being afraid. Not, I mean, for a doctor to push the finger up in you and that sort of thing. Um, yeah, so I had it, I did it, and I felt good. But my thing is the question I want to ask. Um, this when the doctor, and I must say, and this doctor as a female, she seems rather young, still young, and she given her explanation. I wish I wish I could hear a male doctor give their version of what prostate cancer is all about. It's just that it would be interesting to hear from the male how he looks at this, from a woman perspective. But the question is, when you push your finger, or insert your finger in someone, buttocks and so on, what are you actually feeling for? I heard the explanation somewhere about, but I would like the doctor there. What are you feeling for when you insert your finger in anyone's buttocks? Thank you.
All right.
Okay. So, what do you feel for when you insert your finger, your gloved finger? So, you're going to firstly check the size, all right? So does the prostate seem its normal size or is it enlarged, right? And you would also check to see the consistency, right? Which means, is it smooth or is it lumpy, right? If it's lumpy, I'm not saying definitive, it's prostate cancer, but it's an indication that. So if you feel two lobes and one lobe feels bigger than the other lobe, that is also an indication that the person may have cancer, which is the asymmetry that I mentioned. Right? Okay. And also, just to add to what I was telling you in terms of the biopsy, yes, well, I explained the 10 years what I meant, right? But it is not indicated for everyone, right? It is especially based on stuff like the PSA value and family history, right? Because you really don't want to take chances. So for sure, if it's above, different places would use different values. Let me just put that out there. Even different medically accredited sites would have different values, right? So one site will be greater than 2.5. One site may say once it's greater than 4, right? Because we have to investigate what is the reason for the elevated value. If the person out front have some sort of infection, like the urinary infection, then that, more than likely that would be the cause, and we may not be, but I'm not the surgeon still, have to put out there, right? And then it may not warrant a biopsy in that case, right? Okay. And then also it's important, one of the callers said other things could present with similar symptoms like the diabetes, frequent urination. So just because you have changes in the urination, you don't just jump to you don't have to just jump to don't have to just jump to say it's prostate cancer, right? It could be the BPH I talked about, and just a natural process of aging, because you do have changes with age, right?
Right. So we have another call. Hi, caller. Good morning. Caller?
Hello, good morning.
Good morning.
I would like to send over birthday greetings to Tamara Slater of Clay Valley, celebrating her birthday today. And Goldie's greeting is coming from her friend Shakilia Cordes, and hope she may live to see many and many more birthdays to come.
All right. Happy birthday to
Happy
Kamara.
birthday to you too.
All right. Thank you, caller. All right. So we have another call. Good morning. Morning. How are you?
I'm good for the time.
All right.
I used to have changes in urine. We're talking about cancer, but I went and take my PSA test, and I heard some doctor was speaking about changes of urine in on a program. So I went and take a PSA test, and they tell me my PSA test is 0.27, which is normal. But the doctor said if you wake up at night and you urinate more than 4 times, it's not good. But they tell me it's normal, and I used to be waking up 6 and 7 times. But then after I saw it on Facebook about drinking seed and the leaf, and now I drinking seed and the leaf, like the seed and the leaf working, because sometimes 1 or twice a night I wake up and urinate, and I just drink water. Before I go to bed at night, I drink at least a glass of water. When I wake up at morning time, I drink a glass of water. You see, I have some more time in the day, I drink more water, but night I drink 1 glass. And I find the seed and the leaf working. So I thought it was prostate cancer, but they told me no. And they never used the finger up in my anus. What they do, they give me a test. They use needle and take a test from me. And the result was 0.27, which is normal.
Yeah, that's very
so
nice.
Then I don't know. Yeah?
That's very normal. Very, very normal, right?
Yeah. That's what they say, but I use seed and the leaf. I just drink seed and the leaf.
Okay.
This morning itself, I drink some there now. I don't drink sugar. I just use a lot of bush, I just drink a lot of bush. I don't use much sugar, but now and then I drink a little juice and make it taste watery.
Okay.
But still I drink a lot of bush. Any kind of bush, soursop, sugar apple, papaya, mix them together, herbal tea, and drink seed and the leaf. And I find it's normal. So I don't know if you do work with everybody, but I just train it out.
Just in case. All right. So we get you. We get you. All right.
Thank
Thanks
you for your contribution.
Enjoy it.
Let's not forget the importance of natural herbal remedies, right?
Okay. All right. So we just want to see a little bit more time. Maybe like we have a call. Men calling. So I'm not going to. Yeah. Good morning. Hello. Bombay.
Hello. Good morning. How are you guys?
We good. You?
I'm okay.
How are you guys this morning?
We're good.
I'm just listening.
You sure we good? You're talking for everybody? I'm just troubling.
I'm good. I'm good.
Okay, go ahead, Pompey.
We good. I am good.
So are you guys?
And I hope the rest are good too. I believe so. They look so. Unless they're tricking me. I could be tricking people too.
All right. This is Pompey.
Pompey, go ahead. Go ahead. I think that's a delay though, but go ahead.
I listen every morning. What's going on now? I went 3 times already into my prostate cancer. Right? The first time that I go, I went to my regular doctor. I go to the store. Yeah, the first time I went to my regular doctor. And when I went there, it's me and my wife went, and then there I'm waiting, they come on and get me. So back in the back room there, this guy in the back there have something with a condom in his hand, putting on his thing. and put it on his condom. And I asked him, I says, sir, what are you doing with this thing? He said, he going and push that up in my bottom. I said, that's the only way that it can track my prostate cancer. He said, yeah. I said, well, if it's not the only way, have me an excuse. I ain't doing nothing. So I went back around and I asked my wife to ask the doctor himself if there is anywhere else that I can do my cancer, my prostate cancer. The doctor said that I could go to the hospital if I wanted to. I went to the hospital, spent a day in the hospital, and I got it done without, they put me for sleep and do what they have to do. I didn't even know what they do. So, the other time I did it, they sent something to my house. I had to urine in it and send it back to UPS. And then everything is good. So I like it like that. But tell me you pushing up things in my bottom. No, I ain't doing that.
Well, your wife should have made sure that you stayed there and went through the process. That's why you walk with your wife. All right, Pompey. I think that's a deal. All right, Pompey. Thank you for your contribution. All right. I think one of the takeaways I would say with that, though, is that I'm happy to see that in the case of Pompey, that his wife was with him. Because I think many times women need to be the support system for men, especially when it comes to these things. Yes, they might be embarrassed to go through the procedure to have to say, well, this was what was done. But women also need to know the information to be there to help to support men. All right. Let me just take two things that I saw here on the live before we wrap up. So one person is saying give me your thoughts on this. Not having enough sexual discharge and keeping too much of waste in your stomach. Could that also lead to prostate cancer?
Keeping too much waste in your stomach?
Yeah, not sure what that is. I guess maybe not. Well, I don't know if it's not ejaculating
that
enough.
one is not clear. And I would say no with that one. And the other one is what?
Okay, so we have a call and then, right. Hi, Bob, morning.
Hi, good morning.
Morning.
Just want to give my 5 cents as you guys think, yeah. This thing, it's really a funny thing, but I've been going through this thing here. As Coach Joe mentioned, the doctor, they get a new case because every 6 months they send me a stool kit. So once I do the stool test and send it back to them, they check for the colon cancer, prostate cancer, or a blood
like
test.
The colon.
So I never really go through the experience of somebody pushing their finger. But this thing is very important because I learn a lot of that thing since I'm here, and especially here in California, here, the Kaiser Hospital. It's very important what they did, and sometimes we might look at it as why they want this, why they want that, but it's for our own good. So I just want to support the men them out there who's have the experience, because from the day I enter 50, they've been doing this to me. Every 6 months to a year, they send me that stool kit. So they test it from there or a blood test. So it's very important for us men as black men go through these things. So that's my 5 cents. Thank you.
Lovely. And you know what I'm so happy with? You know what I'm so happy with this
Taking charge of your health, Roleza.
No, but not just that we're hearing so many male voices on the topic. That is what it is that I'm so pleased with this morning with this particular conversation. The openness as well. Yeah, but I mean, you know, some persons may not call or whatever, but we're hearing the male voices this morning. So I'm pleased with that. Right? So somebody was asking, do they do genetic history testing for certain diseases? Do we do genetic testing here? Can
probably the private labs, and if we don't do it here, we'll send it out regionally. But Lynch test and BRCA2, those two particular genes would put you at high risk of prostate cancer.
Okay.
BRCA2 is also found in breast cancer. It's also one of the genes.
Oh, okay. All right. So my final question.
You had, before you continue, they had said something. We got interrupted. They were saying with stool, something with the stool not coming out, and there was something else, another point.
No, not quite that. They were saying not having enough sexual discharge and keeping too much waste in your stomach.
I would say no for both of them.
Okay. Okay. Oh, so that thing when men say, well, it back up in the system, it's
wait, they say
not having sexual discharge
as a risk factor.
Yeah.
That could be a complication of the cancer itself, because remember we mentioned erectile dysfunction. And it could be painful ejaculation as well.
Okay, because I know men have this thing, they always say this thing about not releasing often enough, and it could lead to this and lead to that. Is there any truth to that, by the way?
Not to my knowing, in terms of, I guess that's what the person meant. Yeah.
Okay.
Not scientifically, I should say. Maybe. Who knows? Maybe a study might come out and then we might find some link later down the road.
All right. Okay. All right. So my final question, though.
But I know it's always a good practice to ejaculate, right?
Okay. Yeah. All right. So my final question here is, I know that the age that persons, for men, they should go and get tested is from 45, right? But given that we are living in a society where cancers of varying kinds are more prevalent, and we see younger persons coming down with cancers of varying types, do you think that do you think that men should, let's say before the age of 45, start getting regular exams done? And when we talk about regular exams, how often should it be done as well?
So the PSA could be done every 2 years. The DRE, if the person is, comfortable, especially for a follow-up test, can be done. It can be done annually, right? But it's at the patient's comfort as well. Annually for your annual routine checkups could be part of that. Especially if you are of the age where it's common, because remember we said above 50. In terms of the screening before 45, and different sites would say different things. Some sites would say 45 to 69, some sites would say 55 to 69. But I would, when the recommended screening for, if you have I would say if you have a family history, it will be pertinent to screen before at 40 years is the recommendation.
Okay.
I don't think it's necessary to screen before that. A lot of work, science-based works would have been done in terms of the most appropriate age in terms of for screening based on the risk factor. It might not be feasible because as the damage to the cells occur more at an advanced age, right? And then also it puts you at risk of over-diagnosing, right? And especially with something like prostate cancer, it is very slow growing. So we don't want to put, we say you do some screening tests and the patient go on some treatment. And it is, and it's common for the same prostate cancer. And it is, you can do it, but you also have the choice of not doing it. And the person chooses to do it. There are complications of the treatment itself that we need to bear that in mind. Right? Because it have different, a part of the treatment is watchful waiting for the low risk and persons who have a survivor rate of less than 5 years. And there's something also called active surveillance, which basically you're not doing anything. Well, the watchful waiting, you're not doing anything. You're just doing tests every year, right? And if something shows up, then you would intervene. And then obviously, you have more aggressive treatment.
Okay.
Right?
All right. Nicole, any final question for Dr. Williams?
Yes, I'm always concerned about access. And with regard to access of screening for men, like the men who called in, clearly some of them have the benefit of insurance. They have the ability to access either because they can afford it or they can pay or they are their systems are allowing the access for them easily. What happens in the case of underserved populations where people might not necessarily have the wherewithal, the access, or the capacity to go for screening?
So I know for clinics, a lot of things some things are free and some things are at a subsidized cost. And even if you go in the hospital, you still have to pay something, right? Even though it's a small fee. I'm not sure exactly what the specifics or the financial situation of, like, say, the PSA test, but there's also the option of the DRE, right? For resource limited settings, very resource limited. They just absolutely can't afford it. And also there are social worker departments in the hospital for persons who cannot afford it. I don't think that would be problematic for, say, something like a PSA test. I think they would be based, provided the person's financial situation, I think they would be able to help assist with the payment so the person can have the test done, right? Because health matters, health is important, right?
And you see, beyond screening, if there's a diagnosis, then we have to look at mortality and where that stands. So it's important to understand or to sensitize folks who might be, yes, I want to do the screening, yes. What would be the situation following that and after?
That is true. It's a shared decision making, especially for this prostate cancer. You provide the facts to the patients, and if they prefer to opt to just wait and see how it goes, then that is an option, especially if it's a low grade cancer, right? Because men are at risk, all men, once as they age, right? But especially if it's within the gland itself, there's no metastasis, there's active surveillance and watchful waiting where the patients can be monitored, right? And if any rise above a certain level, interventions can be done. They can be referred to surgery, oncology, which is the cancer doctor.
Okay. All right. So we have gone well over time, but this is a well-needed discussion. So I am happy that we had it. All right. So Dr. Williams, the final words to you as we wrap up.
Okay. So prostate cancer, in summary, it's a very important cancer, right? Especially for its favorable prognosis. Is an insidious form, right, of cancer. And I would advise persons to get the necessary screening done at the required age. We discussed 45 to 55 to 69 years of age. And to always remember that prevention is better than cure. So do the necessary things if possible to help prevent it in the first place.
Okay. All right. So thank you very much, Dr. Williams, for being here with us this morning. We were talking about prostate cancer, causes, risk factors, and prevention. All right. And this would not be the last time we have her here with us talking about different subject matters of interest, because our health is what?
Important. Oh, well.
Oh, well.
Oh, well. Oh, yes.
Oh, well. Sorry. So, yes, we will have her back again on another occasion. But thank you very much for being here with us this morning.
Thank you very much for having me, guys.